Good morning, everyone. Today I am going to present comparison of the efficacy of topical cyclosporin and tacrolimus in moderate to severe dry eye. This clinical trial has been registered in ctri.gov.in. This is not moving. I have no financial interests. Dry eye is a multifactorial disease which causes hyperosmolarity of the tear film and subsequent inflammatory disease, for which we generally treat with the topical lubricants and anti-inflammatory medications. Previously, we used to use glucocorticoid, but due to long-term steroid, we have shifted to the immunomodulator, most commonly cyclosporin. There is another drug, tacrolimus, of same group, which is studied limitedly rather than cyclosporin. So for that, we have a primary objective to do a study to compare the therapeutic effectiveness between the cyclosporin A and tacrolimus in treating moderate to severe dry eye by Sharma score, T-BUT, and corneal staining score, with a secondary objective also to see the improvement in OSDI score, functional visual acuity, compliance to the treatment, usage of the tear substitute, and the safety. For that, we have done a prospective interventional active control parallel group randomized double mask single center study with 256 eye of 128 patients, where 64 in each group. The study has been done for 1.5 years with 4 phases. The inclusion criteria were the age were from 18 to 74-year-old with OSDI score more than 13, Sharma score less than 10, corneal staining score more than 1, and T-BUT less than 10 seconds. With exclusion criteria, if the patient who have any systemic drugs which can cause the dry eye, any disease, systemic disease which can influence the dry eye, any lactating mother, or any intracorneal or intraocular disease patients have been excluded from this study. The study schedule shows there are 6 visits. First is for screening, second is for randomization and intervention, and 3, 4, 5, 6 was for the follow-up. After randomization, the patient who has been given to the group A were receiving topical cyclosporin A 1 drop 2 times per day with topical lubricants, and group B were receiving topical tacrolimus eye ointment 2 times per day in lower fornix along with the topical lubricants. The outcome what we have measured was OSDI score, functional visual acuity, Sharma 1, T-BUT, corneal staining score, the number of tear substitute drop used, compliance to the treatment, and adverse reaction. As a result, we can see the both group has a age-matched and gender-matched normally distributed population with female preponderance noted in both group. The comparison of the Sharma score shows that there is gradual increase in the Sharma score, which is significantly improved over the time period, but at month 3, there is a statistically significant improvement in group B, those who have received the topical tacrolimus. In case of T-BUT score, the similar result has been seen, but in month 2 and month 3, there is statistically significant improvement in topical tacrolimus group. Comparison in corneal staining score shows there is improvement in corneal staining score over the time period in both groups, but there is no statistically significant difference between 2 groups. Same is for the functional visual acuity and the OSDI score. The safety, what we have got, that the most common adverse reaction what we have seen is the redness and the burning sensation, which is more common in tacrolimus rather than cyclosporin. The compliance of the both group was approximately 98% in both group, and number of tear substitute usage has got decreased over the time period. There are multiple studies has been done with cyclosporin, but only one study has been done with tacrolimus. And recently, one clinical trial has been published, which where there is a comparison between tacrolimus and cyclosporin in case of Sjogren syndrome, where shows there is no significant difference between 2 drops. This is the similar kind of result what we have got in our study, where there is no difference between the most of the parameters except the Sharma score and the T-BUT score. The limitation of this study is to there are 2 different types of drug administration modes has been used, which can lead to bias, and the follow-up time period should be more to see if there is any late complications for the longer post-treatment outcome. These are my references. Thank you.
only thing is there's a small, you've basically shown that both work the same.
Yes, ma'am.
That's what you've shown. So one small point is that there's an anecdotal and remote chance of triggering of epithelial malignancy with tacrolimus. Are you aware of that? So in patients who have dry eye, who have an association like xeroderma pigmentosa or OSSN, there your cyclosporin may score over tacrolimus. But otherwise, we've also clinically seen it to be this.
Yes, ma'am.
Thank
But
you.
those are actually excluded from
Exclusion
this.
criteria. No, in real-time practice, I'm saying.